first quarter of 2020 earnings of publicly traded U.S. health insurance companies are in and are showing that the impact of the COVID-19 pandemic to date has been less severe than anticipated. Here to discuss the best commentary on the subject are Sally Rosen, AM Best Senior Director, and Joe Zazzera, Director. And Sally, as I mentioned, the commentary notes that the coronavirus impact to health insurers so far this year has not been that significant. What were the leading factors behind that?
Sure, John. Couple of things. First of all, the uptick of the whole coronavirus pandemic did not really occur until probably second half of March. And at that time, there was concern about the use of the availability of PPE, personal protective equipment, as well as trying to flatten the curve, which resulted in numerous states issuing stay-at-home orders, as well as the deferral of elective surgeries, routine care, non-emergency type situations. And as a result, this has resulted in a decline in claims. However, because it happened so late in March, there was not much of an impact in the first quarter. The other thing I would add is that for the majority of individuals who are diagnosed with COVID, and I think there's over 1.5 million, but I think the number's growing that are diagnosed, the majority of those individuals are treated at home, and there is no treatment for those individuals. It is mainly just a test, and then they self-quarantine at home. So the claims from the hospital, for those that have been hospitalized, have been more than offset by the decline in regular routine care and elective procedures. The other thing I would just note is this is a situation we have not seen before. During a pandemic, claims are expected to increase, and actually the utilization has actually declined because of the deferral of care.
The job loss isn't what we expected. This is not the same as when there's a recession and the expected job loss. Most people wanted to keep their jobs, wanted to keep their insurance. So we didn't see this manifest in a decline in enrollment for the health insurers. Many of the employees were furloughed rather than laid off. Many employers actually allowed their employees to keep their health insurance. In addition, the Paycheck Protection Program provided financial assistance to small employer groups, which allowed them to keep their workforces employed. And many carriers have individual Medicaid, so even for those employees that lost their job, health insurers were able to keep those employees in the enrollment numbers. As we continue on with COVID, if this persists longer, that's when we expect that there could be more closures and potential impacts to enrollment.
Could you discuss the medical loss ratio dynamic, Sally, and how that's playing out so far in this situation?
Sure. So the lower utilization began in the second half of March, and I don't want to say accelerated, but expanded in April as there has been no elective procedures across elective surgeries, and that's gone across the country. And as states are starting to reopen, but that has resulted in a lower loss ratio than health insurers have expected. And many carriers have implemented initiatives for the benefit of their members. In addition to waiving the cost sharing for COVID testing, COVID claims, they've also been waiving copays for telehealth, waiving copays for in-network for Medicare Advantage members. Some insurers are starting to provide premium credits. And the loss ratio is something that health insurers are monitoring closely, especially as states reopen and we start to see an uptick in claims.
Yeah, I would just chime in and say that some of the carriers that we've talked to have talked about telehealth, and there's been an exponential increase in telehealth visits. Some are still paying at parity with an office visit. So that is something that could cause the MLR, as well as the items that Sally talked about with cost sharing and premium credits for employers, that could cause the MLR to stay steady and not increase or decrease much from what was expected.
Now, there are multiple aspects to the effect of COVID. How did the first quarter look, Joe? And do you think the picture will change in the second quarter?
We've talked to companies about several items, operational utilization, or the MLR, as Sally was alluding to, and then economic or investment impacts. From an operational standpoint, health insurers during the first quarter were most concerned with their employees, their members, and the communities that they operate in. And they were able to get their workforces working from home for the most part. Their customer service and member service stayed intact. They increased their online presence and capabilities, and claims payments, from what we've seen so far, haven't seen a hitch. So operationally, they've done good in the first quarter. Sally talked about the utilization and the claims benefits. I would just say that there could be some claims lag, that moving into the second quarter, we could see some of the claims or larger claims that might show up in the second quarter numbers. And that's something we're going to keep an eye on. And from an economic standpoint, as we look at interest rates and volatility in the equity markets, there was a lot of exposure in the health industry to equities. During the first quarter, we saw significant losses, but many insurers have reported recoveries through April and into early May. So we don't believe that going into the second quarter, there should be many issues with the investment portfolios, but we're going to keep monitoring the trends.
And to add to that, I would say that, states and health insurers are watching closely as states start to reopen and care may begin to resume. Some states have started to allow elective surgeries. Doctors' offices are starting to reopen in certain states. With regard to elective surgeries and procedures, the more serious surgeries, although they're elective, are most likely to resume first, people with more serious conditions. But individuals have to be willing to go for care. And there is some concern that people may not right now be willing to go back into a hospital setting or an outpatient surgery setting for a procedure just because of the whole pandemic and the COVID situation. But they are watching that closely. And then the other thing I would just add is, as the situation continues to unfold, the longer the states have closures, stay-at-home orders exist, as Joe mentioned earlier, there is a likelihood that some of these furloughs could turn into layoffs and become more permanent. And at that point, we would expect individuals to switch to either go from a group plan to an individual ACA exchange policy, perhaps a Medicaid policy, depending on their income level, or they could even pursue a ACA non-compliant policy just to have medical coverage.
Sally, are we seeing any evidence of health insurers revising their earnings guidance for 2020?
At this point, we have not. All the publicly traded have affirmed their guidance at the first quarter. The deferral of care more than offset the cost of the treatment thus far for COVID, the testing and the treatment. It's something that health insurers are monitoring closely as states reopen and procedures start to resume and care starts to resume. It's going to be monitored closely. But again, nobody knows what's going to happen if there's a second wave.
Outside of the large publicly traded companies that we follow, there are many regional providers, single state blues, and there's been a range of expectations as far as guidance that they've provided us with. Some of them are doing scenario testing and showing low, moderate, and high severity, what the expectations could be in their guidance. And while initially some have indicated it could be on the higher end, they've come back to us and said that it looks like results are going to show up more in the low end of their expectations. So it's in line with what we've seen across the industry, that the impacts of COVID haven't been as severe as we would have expected as soon as we heard the pandemic was starting to hit.
And just one last comment, John. I would say that, this is an evolving situation, and as the situation, as coronavirus or COVID continues to progress throughout the United States, it's something that both AM Best and health insurers are keeping an eye on, whether there's a second wave, whether there's not a second wave, what happens with utilization. It's something everyone is monitoring very closely, both AM Best and insurers.
Thanks, Sally. Joe. That was Sally Rosen, AM Best Senior Director, and Joe Zazzera, Director. You can find the full commentary online at ambest.com. For AM Best TV, I'm John Weber.